Bismillahirrahmanirrahim. In this lecture, we are going to discuss the different signaling pathways used by the hormones to produce their effect. We can basically categorize the hormones into two categories. First are the hormones which are lipid soluble. These are lipophilic hormones. They can enter the membrane. So they have intracellular receptors. As you can see in this diagram, there are some intracellular receptors and other hormones cannot enter the membrane. So they have receptors on the surface of membrane. That is why they are called as the surface receptors. First, let us have a look on these intracellular receptors. So there is a diagram given to explain the mechanism of these lipophilic hormones. Have a look on this diagram. This hormone is a lipophilic one. It can be a steroid hormone such as testosterone, estrogen, these kind of hormones, thyroid hormones, vitamin D. This hormone can enter the membrane and so they have an intracellular receptor. The receptor may be out of the nucleus or the receptor may be inside the nucleus. Anyways, there is an intracellular receptor and the hormone enters inside the cell and then it produces its effect. How it produces its effect is not that important. The important factor is that steroid hormones are lipophilic and they enter inside the cell. Now, some other factors about steroid hormones are mentioned over here, although they are not related with the signaling pathways, but since they are mentioned, so let us talk about that. Steroid hormones basically have steroid hormone binding globulin inside the blood. Since these steroid hormones are lipophilic, they can easily cross the membrane, but they will have difficulty while traveling in the blood because blood is water based, right? So they cannot be, very comfortable in blood. That is why they have sex hormone binding globulin. So they bind with these water soluble globulins and then they can travel in blood very comfortably. So what basically happens is that when there is more amount of binding globulin, this means that free sex hormone is decreased because most of the hormone is bound with the binding globulin, right? So more amount of sex hormone binding globulin means that free hormone is decreased. Now what happens is in a male, if there is more sex hormone binding globulin, there will be less free testosterone. And less testosterone is a problem in males. It will cause gynecomastia and other symptoms. Similarly, if there is very less amount of binding globulin, so there will be more amount of free hormone, and more amount of free hormone can be maybe troublesome in females. So increased free testosterone can cause hirsutism, which means hair on face and these kind of symptoms. Other than that, they are mentioning that estrogen can increase sex hormone binding globulin. And of course, you'll have a scenario in which there's a patient who was taking oral contraceptives. And so you have to understand that oral contraceptives means increased estrogen, which means increased sex hormone binding globulin, which means decreased free testosterone, right? And that can lead to any kind of symptoms. All right. So this was the signaling pathway for steroid hormones, for lipophilic hormones. Now, which hormones of this pathway? You have to memorize it. They can definitely judge this knowledge. They can have an MCQ in which they ask that the hormone responsible for this pathology used this signaling pathway. So you must know the signaling pathway used by each hormone, at least the important ones. So you can have a look at the intracellular receptors over here. Intracellular receptors are used by progesterone, estrogen, testosterone, cortisol, aldosterone, all the steroid hormones, and steroid hormones and the thyroid hormones. They are synonyms. The steroid hormones and the thyroid hormones, they use the intracellular receptors. Vitamin D also use intracellular receptors. Now, once we have discussed the intracellular receptors, remaining hormones cannot enter the cell membrane. That is why they have a surface receptor. They have a receptor on the surface of the cell, and the hormone just binds to the surface receptor and then produces its effect. Now, the surface receptors produces effect inside the cell by different mechanisms. One mechanism can be that the surface receptor produces a second messenger such as inositol triphosphate, such as cyclic AMP, cyclic GMP. These can be the second messengers. So a surface receptor can produce a second messenger, which can produce an effect, or the surface receptor can itself produce some changes. So such receptors are basically tyrosine kinases. I mean, they do their effect through tyrosine kinases. Now let me explain something about tyrosine kinases. So let us have a look on this table now. Right. So what basically happens is, let's have a look on this diagram. For tyrosine kinase, the main hormone involved, or you can say the most important one, is insulin. We have studied it very well. What happens is that insulin binds on the hormone. The insulin receptor has four subunits, two alpha subunits and two beta subunits. Although I've discussed the details already when we studied insulin, but I'm just revising them. And this hormone has tyrosine, right? So when there is attachment of insulin, this tyrosine is phosphorylated, which is called as the autophosphorylation. And this autophosphorylation then produces effects inside the cell, because this autophosphorylation leads to regulation of gene transcription. So this is basically the tyrosine kinase receptor, because by tyrosine kinase we mean an enzyme which phosphorylates tyrosine, right? This is a tyrosine kinase receptor in which the receptor itself is phosphorylating a tyrosine. There can be other situations in which the receptor is, have a look on this diagram. Here we do have a tyrosine kinase, but the phosphorylation of tyrosine is not occurring by the receptor itself. It is not autophosphorylation. But what happens is, as soon as the hormone attaches, a JAK is activated, right? This enzyme is activated, and via the JAK STAT pathway, this enzyme ultimately leads to the phosphorylation of tyrosine. So in both of these surface receptors, there is phosphorylation of tyrosine, but in case of insulin, it was autophosphorylation. In case of JAK STAT pathway, there is phosphorylation via JAK, right? So this kind of signaling pathway is used by mainly the insulin and the growth factors, right? You can memorize insulin also has like insulin growth factor, although insulin growth factor is related with the growth hormone, but you can memorize it like this: insulin growth factor. That is why all the growth factor uses this kind of mechanism. Have a look on this the table now. So we have the growth factors called as the insulin-like growth factor, fibroblast growth factor, platelet-derived growth factor, and you see all the growth factors uses receptor tyrosine kinase. And the non-receptor tyrosine kinase, which means the JAK-STAT pathway, which I have just elaborated. This pathway is used by the cytokines such as erythropoietin, thrombopoietin, and these kind of things. And important hormones are prolactin and growth hormone. So prolactin, growth hormone, and cytokines are using JAK-STAT pathway. Insulin and growth factors are using receptor tyrosine kinase. Or for more easy memorizing, you can consider it as a single category. They may not go in so much such detail to analyze your knowledge. One thing is very important: you must know insulin acts by autophosphorylation. Other than that, you may memorize that growth hormone, prolactin, all the cytokines, all the growth factors, all of them act by tyrosine kinase. Right? So cytokines, growth factors, prolactin, and growth hormone. Growth factor, growth hormone. Insulin like growth factor, insulin. So they are kind of related, and it is easy for you to memorize them. So now coming towards the flow chart, what we have already discussed is you can see the surface receptors, and surface receptors we see that there are tyrosine kinase, and tyrosine kinase there is JAK-STAT, which is used by the prolactin, growth hormone, and cytokines. And then there is autophosphorylation by the receptors, which is used by typically insulin and the growth factors. Now let us have a look that surface receptors also act by second messengers. Let me show you a diagram for second messengers. What basically happens is that there is a hormone, and the hormone comes on the receptor. As soon as the hormone comes on the receptor, there is the production of a second messenger, and then the second messenger produces different changes. Now, second messenger can be cyclic AMP, it can be cyclic GMP, and it can be inositol triphosphate. So, what hormones uses cyclic GMP? The vasodilators, right? So it is easy to memorize: brain natriuretic peptide, atrial natriuretic peptide, and the endothelial derived relaxing factor. It is basically also involved for vasodilation. All three of them uses cyclic GMP. Till now, it was easy to memorize. All the steroid hormones uses intracellular receptors. The cytokines, the growth factors, insulin, prolactin, growth hormone, they uses the tyrosine kinase. And now cyclic GMP is used as a second messenger by brain natriuretic peptide, atrial natriuretic, all the relaxing factors. All right. What is kind of difficult to memorize is that what hormones uses cyclic AMP and inositol triphosphate as the receptors. So there are quite a lot of names in this category. So cyclic AMP is used by most of the stimulating hormones. I mean, most of the hormones of pituitary gland and the hypothalamus, they use either this or this. Although we have already studied growth hormone and prolactin, these were the exceptions. The growth hormone and prolactin by the pituitary is using non-receptor tyrosine kinase. Posterior pituitary hormones uses inositol triphosphate. As you can see, oxytocin is a posterior pituitary hormone and ADH is a posterior pituitary hormone. What is more interesting is that ADH and histamine has multiple receptors. So ADH and histamine has V1 and H1 receptor, which uses inositol triphosphate as second messenger, and they have V2 and H2 receptors, which uses cyclic AMP. You can see H2 of the histamine and V2 of ADH, or you can say vasopressin, uses cyclic AMP. So one receptors as one, you see, I is similar to one. So one receptors are used by this and that. All right. So follicle stimulating hormone, this luteinizing hormone, and then ACTH, TSH, CRH, all of them are using cyclic AMP as this second messenger. And on the contrary, GnRH, gonadotropin releasing hormone, and thyroid releasing hormone, they are the hormones of hypothalamus, which are using inositol triphosphate. So you have to memorize this table, and I hope you can memorize it well. Thank you very much. We'll have another video on the pathology now.